Welcome to The Deal. I'm Jane Sell. Today we're joined by Simon Gisby of Deloitte to discuss hospital mergers. Simon, there are about 6,000 hospitals in the US.
Right.
M&A is continuing, but at what point will deals slow? What's the long-term sustainable number of hospitals in the US?
Well, that's a great question. I don't think anyone knows the answer. What we have seen is, if you look at the report from the Deloitte Centre of Health Solutions, we saw about 100 deals, 2007, tracked down again 8 and 9, partly because of the economic slowdown, and that's picking back up again. We did about 109 deals last year. But we anticipate, and if you talk to hospital executives around the countries and people who advise hospitals on strategy and M&A, we anticipate a wave of consolidation in the future, driven by the Affordable Care Act, increased costs, the need to provide different services for patients and consumers. So I think this wave is going to continue in the future.
Right. And what's the diagnosis on the financial success of deals that have happened so far in the years following?
Well, the report looked at 101 deals that were closed in calendars 2007 and 2008, representing about 80% of the deals that closed in those years. And what we did was we tracked the financial performance of the hospitals for the following 2 years after the acquisition. And what we found out was, regardless of whether the acquirer was a local hospital in the market or a national chain, the financial performance of those hospitals improved after the acquisition during the subsequent couple of years. So it tended to suggest that the hospital that was acquired, the financial performance improved post-closing.
Right. And how about the quality of healthcare? Does that improve after a deal?
The report doesn't go into the quality of healthcare, but it does recognize that, for example, in 2008, there were hospitals that had a negative margin, EBITDA margin, a recognition of financial performance of negative 1.8%. Those hospitals were acquired by local, in-state health systems. 2 years subsequent to that, that margin improved to 5.3%. That's almost a 400% improvement in financial performance. When you generate that kind of money, you can reinvest back in healthcare. You can reinvest in technology, you can reinvest in physicians, you can reinvest in clinical services, right, which will improve the outcome of healthcare in the community.
Okay, so logically better financial performance should lead to
logically better financial performance
Mm-hmm.
should lead to improved services for the community, yeah.
Okay, and what are some of the common elements of deals that go wrong or go right in this space?
Approximately 2/3 of the acquisitions that we looked at, the buyer was a not-for-profit. And in 50% of the times, the actual target was a not-for-profit hospital as well. They have very different dynamics in the deal world compared to corporations that we read about in the Wall Street Journal and other newspapers. With a not-for-profit hospital, culture, the collaboration, the mission of those charities effectively getting together becomes critically important. So one of the key determinants is making sure that there's a cultural alignment in the mission and vision of those two charities combining to deliver better care. It's not just about the numbers.
Right. Thanks for your time, Simon. I'm Jane Sell from The Deal.